How do medications induce pancreatitis? Imagine your pancreas as a busy factory, producing enzymes and hormones essential for digestion and blood sugar regulation. Sometimes, certain medications can interfere with this delicate process, leading to inflammation known as pancreatitis. Although medication-induced pancreatitis is relatively rare, it is an important cause to be aware of, especially for those on long-term therapies. Medications can cause pancreatitis through several mechanisms. One way is through direct cellular toxicity. Some drugs or their breakdown products can harm the pancreatic cells that produce digestive enzymes. When these cells are damaged, enzymes like trypsin can become prematurely activated inside the pancreas, causing it to start digesting itself and becoming inflamed. For example, drugs like valproic acid and certain antiretroviral medications can impair the energy-producing parts of pancreatic cells called mitochondria, leading to cell injury. Another mechanism involves immune responses. Some medications can trigger allergic or hypersensitive reactions that cause inflammation in the pancreas. This immune-mediated response is often unpredictable and does not depend on the dose. Azathioprine, a medication used to suppress the immune system, is known to sometimes cause pancreatitis through this pathway. Certain drugs also affect the body's metabolism in ways that increase the risk of pancreatitis. For instance, some medications can raise triglyceride levels significantly. High triglyceride levels are a well-known cause of pancreatitis because they can block blood flow and cause damage to the pancreas. Disruption of the pancreatic ductal system is another pathway. Some drugs may impair the cells lining the pancreatic ducts, leading to leakage of enzymes and subsequent inflammation. Certain medications can influence cellular signaling pathways, such as those involving SRC kinase or epidermal growth factor receptor, which are important for cell repair and growth. When these pathways are disturbed, the risk of inflammation increases. Oxidative stress is also a factor. Some medications generate reactive oxygen species or free radicals that damage pancreatic cells. For example, metronidazole, an antibiotic, can produce harmful radicals like hydrogen peroxide, which can injure pancreatic tissue and trigger inflammation. Lastly, some reactions are idiosyncratic, meaning they are unpredictable and not related to the dose or known mechanisms. These reactions may involve genetic factors or individual sensitivities, making them harder to anticipate. Common drug classes linked to pancreatitis include certain anti-HIV drugs, statins used for cholesterol, tetracycline antibiotics, valproic acid for seizures, angiotensin-converting enzyme inhibitors, and some chemotherapy agents. The timing of pancreatitis symptoms after starting these medications can vary from a few days to several months. From a health perspective, it is important to recognize that if someone develops pancreatitis while on medication, doctors will carefully review their medication history. Discontinuing the offending drug usually helps resolve the inflammation. Supporting care such as hydration, pain management, and nutritional support is also essential. Understanding how medications can cause pancreatitis highlights the importance of monitoring and cautious prescribing. While these reactions are rare, being aware helps in early detection and prevention of further pancreatic damage. If you are taking any medication and experience symptoms like severe abdominal pain, nausea, or vomiting, consult your healthcare provider promptly. Always remember that individual responses can vary, and medical advice tailored to your specific situation is key to maintaining pancreatic health.